Hi there, this is Amelia Heart and Vascular Center, and today we're going to present to you about atrial fibrillation. Maybe you or someone you know has been diagnosed with AFib, and so let's learn more about what this condition is. What is atrial fibrillation? I'm going to pause here on the drawing so then you can hear a little bit about the definition before I show you the images. Atrial fibrillation is when the heart beats irregularly and is too fast or too slow. This occurs because the beat in the heart's upper chamber is out of sync with the beat in the heart's lower chamber. Now that we know the definition, I'm drawing here on the left side a normal heart and on the right side a heart with AFib. In a normal heart, the impulse goes from the top chamber down to the bottom chamber and through the ventricles, as you can see in the arrows. But in AFib, there's an abnormal impulse, and the atrium just quivers and does not send a good impulse to the ventricles, causing it to be irregular and out of sync between the upper chamber and the lower chamber. While atrial fibrillation is not life-threatening and it shouldn't be something you should be scared about if you get it treated, it can increase your risk of strokes and clots, and that's something important to take note of. So, what are some of the common causes that can lead a patient to be in atrial fibrillation? The first is high blood pressure. This can cause stress on your heart over time and cause it to enlarge. The second is a history of heart attacks or a recent heart attack. The third would be coronary artery disease, which is blockages around your heart, which can cause stress on your heart as well. Another would be untreated sleep apnea. Untreated sleep apnea can cause stress on the heart at night when you're not breathing correctly. The fourth is just aging. Naturally, some people develop AFib, and we aren't sure exactly why. And the fifth reason is other. There may be other reasons why a patient develops AFib. What are the symptoms of atrial fibrillation? The first may be racing and pounding in your chest or some sort of chest pain that you experience throughout the day. Another possible symptom is lightheadedness or dizziness, feeling like you're going to pass out, or extreme fatigue. And lastly, some patients don't feel any symptoms and they're told about having atrial fibrillation once they are diagnosed by a doctor. There are multiple ways to be diagnosed with AFib. The first that's most common is an EKG or an electrocardiogram. You may go to your primary care, they take the EKG, and they notice, oh, you're in AFib, and refer you to cardiology. The second is an echocardiogram. At a cardiology clinic, you may get an ultrasound of your heart, and the technician may notice that your heart is not beating correctly and that you are in AFib. The third is a Holter monitor. These are placed on patients to monitor their rhythm and can show that a patient is in atrial fibrillation. And the fourth is that it could be incidentally seen on a stress test, which has an EKG component in the test, which can show atrial fibrillation. You're probably wondering by now, how can I treat my atrial fibrillation and feel safe with this condition? There are treatments that are out there that work really well as long as you stay on top of your medicines and follow your provider's recommendations. All patients with atrial fibrillation get prescribed a blood thinner. The point of the blood thinner is to prevent strokes. People with AFib have an increased risk of stroke because the bottom chamber and the top chamber are out of sync with each other in the heart, and this can cause a clot to form and to be lodged into the lungs, the brain, or other parts of the body. Along with the blood thinner, there's two different ways to treat atrial fibrillation, and both ways are perfectly good and great at treating AFib. The first is rate control. Rate control means decreasing your heart rate so your AFib burden is not as abundant and frequent on your heart. And the way that we decrease your heart rate is through medicines. You may have heard of things called beta blockers, or metoprolol, or propranolol, or things like that. These are medicines that decrease your heart rate and are called a beta blocker, and this is a great way of treating AFib along with a blood thinner. The second form of treatment would be rhythm control. This is when we try to get your rhythm out of atrial fibrillation back into normal sinus rhythm. In order to do this, your provider would have to recommend a procedure called a cardioversion, where they shock your heart rhythm back into normal sinus rhythm. If this fails, you may need a procedure called an ablation, which is a minimally invasive procedure performed by electrophysiologists. Depending on your medical condition, you may go one pathway or the other, and it's up to you and your provider and whether or not you can handle a certain pathway. Now, patients always ask, what can I do besides medicine to help my atrial fibrillation? You can eat healthy, you can exercise routinely, You can make sure that you're maintaining a healthy weight and lose weight if it's necessary. Quit smoking. Take your medicines as prescribed. This is vital for AFib. And make sure to not drink alcohol since you're on a blood thinner. Thank you so much. This is Amelia Heart and Vascular Center. Please look at our website for more educational videos and blogs. We appreciate it and have a great day. Bye-bye.